Hello, everyone. My name's Hardip, and I've been a nurse with Fraser Health for 24 years. And my background is mostly working in the emergency department. One thing that really stands out is how big Fraser Health is. It's a very large geographical area. And what you realize is with 12 hospitals spanning from Hope to Burnaby, we cover a large area, and there's just that many different jobs that one could try. Like when I signed up as a nurse 24 years ago, I don't think I would have done as many roles that I did if Fraser Health wasn't so big. So I always had these opportunities come up. And I think it's because we were always expanding and growing and getting bigger and bigger. I've been a charge nurse, I've been a clinician, coordinator, manager, and it also gave me career growth, but also a lot of work-life flexibility because the more skills you have, there's just more opportunities that come up. When I look back throughout the last few decades, I was able to be a mom to my two boys and also have a career. I worked weekends and night shifts for the longest time. And then now I've switched over to more of a Monday to Friday role. I feel like there's just so many opportunities. It's really exciting to be a part of such a great organization. So I'm very proud to be a part of Fraser Health. Trying all these different things also meant I had to leave my comfort zone, which was hard at first, but got easier over time. I think I was doing emergency nursing for about 12 years when I took the step to become a charge nurse. And that was a really big step for me. But I realized that learning is a skill too. And once you get through that learning curve, everything kind of falls in place. And I feel like every role I've done has been similar. So I'm not as hesitant to try something new anymore. I'm just more patient with myself. And I know I'm part of a very supportive team where everyone's going through learning and changes all the time. So we're all going through it together. We're all growing. So we all really understand and support each other. And with all this personal growth, I mean, if that happened, I think best way to describe it is I feel like I've blossomed to this potential that I didn't ever think could be possible. There's always this shy, quiet person who sat in the back, never wanted to put up my hand, in class or anything. And now I'm confident. I'm able to advocate for patients, speak to doctors, stand up for a patient, whatever their needs might be. And I feel very passionate about, being able to do that. So existing, and I think it was also good for my kids to watch me do this. They're teenagers now, but to watch mom continue to grow and learn. And I think it just shows them also that you have to work hard in life, and learning is lifelong. Because I really value the work-life balance. Being able to be a mom. This is what I did many years ago when I started, and I highly recommend doing the transition line. In the emergency, I worked within my scope with stable patients, and whenever there'd be codes or things happening, I'd jump in and do CPR, and I'd let the ER trained nurses kind of handle, what they were doing with all the infusions and everything. I'd watch the nurses and the doctors. We worked together, and I got to be a part of the team. And I remember my confidence just exponentially growing, learning from nurses that have decades or all this experience. They've got this comfort and way of doing things. You can learn all their tips and tricks. So I think it's like the best way to learn is learn from someone who's been doing it and work alongside them, and your confidence just grows. Really recommend the transition line. And you're not tied into anything when you do the transition line. It's a great way to try it out. Most people do end up going through with the education because if you come into the ER, there's something that's obviously drawing you in. And if you do, did take a transition line and 6 months down the road, you decide it wasn't for you. But I find that most people that even sign up for things like this, they kind of like that fast pace and they like that kind of nursing. The other thing is you've got a lot of autonomy to make decisions based on your assessment. So I love the fast pace, love seeing what's coming in, not knowing what's coming in next. And the assessment skills that you learn in emergency nursing, you're able to diagnose or you kind of figure out what's going on. And I love being able to work at my fullest scope as a nurse. I really value that. I think the other thing is the bond that you create, it just turns into these lifelong friendships with your colleagues. So you just develop like a second family is really what I would call it. So I really look forward to any work related activities. We're always having a Christmas party or Halloween parties or whatever it might be. But I always been very fortunate to have always worked along such great people. I find that this is a very meaningful career feel very fortunate to be able to work in a field that I'm passionate about and I have meaning and purpose. Because when people come to the ER, like, they're vulnerable and they're afraid and they're not in their usual state of mind. So the way they might be on a regular day isn't what I'm going to see when they come visit the ER. They come to the ER not because they want to, but because they have to. So it always feels like a privilege when people open up to you, they trust you. These are strangers in crisis and they just come to you with support. So it always feels like a privilege to be a part of their lives. And I think the older that I've gotten, I've realized, no one's immune to coming to the emergency. You never know what's going to happen. So having my own kids use the emergency, my own parents, family, running into coaches from hockey, the neighbors, the grocery store attendant. So you just realize that these are regular people, a part of my community, that they don't have a healthcare background, but when they use the emergency, it just makes me feel more proud just to be able to help my community. Just regular people that are doing everyday things and really relying on such a great service. And even my parents getting older and my grandparents, I remember my grandma came in and I remember feeling so thankful. You experience the emergency, I guess, on from the other side, being the patient perspective. Really are more and more thankful for all the staff that do what they do. And it just, echoes how important that the work is. Thank you for listening to me.